Panja is a 6-year-old snow leopard we've had at the zoo. They are an endangered species. So he was showing him with a lameness, started about almost 6 weeks ago. We gave him some pain medication because sometimes they injure themselves in their exhibits, and obviously we can't put a hands-on exam on them because they're a wild animal. The medication was not making things better, and he started to limp more. So we sedated him and took some x-rays and realized that he has hip dysplasia, which is a degeneration of the hip joints, and he also has arthritis in both of his, what we would call his knee joint or a stifle joint. It was decided that the best course of therapy would be to try to do a total hip replacement, and I've known Dr. Acker for a very long time, and I called him and he agreed to attempt this procedure and see if we can keep the animal comfortable and pain-free.
Today we went in for an artificial hip replacement. We have a real good team. We do a lot of hip replacements. The big surprise when we got in there is attached to the joint capsule right down in here was a large tumor. The tumor kind of started at the medial joint capsule here and extended on up. I could kind of see some bulgy muscle, and I thought the approach was a little bit unusual. So this was a lemon-sized tumor attached to the joint capsule. So that made the anatomy a little abnormal, made the approach a little abnormal. So intraoperatively, we had histopathology done at the hospital, and they determined that it was a synovial cell sarcoma. These tumors don't spread to the lungs, but they are locally invasive. So at that point, decisions were being made. Should we euthanize the patient on the animal on the table? The leopard's owned by a zoo back east, and it's their choice. Should we go ahead and implant the hip? The patient's going to feel better with an implanted hip, or should we amputate the leg? Amputation of the leg was unacceptable by the zoo. Euthanasia, I don't think we had all the permissions yet, and then so we went ahead and replaced the hip and removed as much of the tumor as we could. Sometimes dogs with synovial cell sarcomas, this dog had a synovial cell sarcoma of the tumor. You note he has 3 legs. This dog's been amputated for 4 years. The owner's quite happy with this dog and was really happy to go goose hunting with him today. So dogs and animals have 3 legs and a spare, so to speak. But in the zoo situation, they felt this leopard would be attacked and picked on, and so that wasn't acceptable. So today, we're quite happy with how the biometrics total hip went in. Biometrics actually donated the hip, and so we're quite happy with how the hip went in. The patient had a few anatomic abnormalities, but everything went in well. Nice cup placement. The stem is good for the sclerotic or thickened femoral neck. And we think the patient will do fine with a replaced hip and actually be out of pain. Unfortunately, we don't feel that all the tumor's been removed, so reoccurrence within 6 months and euthanasia is probably the likely outcome. There is a breeding season coming up, and I think this leopard still has a chance to breed this spring. The whole team project here today, there's a safety officer from the zoo, Dr. Rhonda Aliah was in charge of the anesthesia, Denise Young, my CVT, so it's a team effort. I do a lot of hip replacement, and so they selected me to help with replacing the hip, and then Biometrics was lucky enough to donate the implants for the case. So we did the best we could for the cat, and hopefully it'll be more comfortable while he lives.